You are listening to Hit Play, Not Pause, a feisty menopause podcast for active, performance-minded women. I am your host, Celine Yeager. Each week, I bring you advice from athletes, scientists, researchers, and other experts to help you feel and perform your best, no matter what your hormones are doing. This show is a production of Live Feisty Media. Hello, strong, feisty women. Welcome to Hit Play Not Pause, the podcast that won't ride up, bunch up, or otherwise be a real pain in the, seriously. This is not a show about underwear, though it is one where we're going to talk about underwear. Our sponsor, Paradis Performance Underwear, has a very rad medical ambassador named Dr. Lauren Puretz. And as I was looking into them and into her, I saw she is definitely our people, as they say. For one, she is a kick-ass ultra runner. And just for a few accolades that she has racked up last year at 41, she secured a third place finish at the 2024 Javelina Jundred, and she completed that 100-mile trail run in 15 hours and 50 seconds, the ninth fastest time by a woman on the course. She also won the World Masters Mountain Running Championship last year, all on top of being a mom and a practicing gynecologist who specializes in helping women during hormonal transitions like menopause. So I thought, let's do a show. And we talk about it, including her quest recently to qualify for Western States, which is the world's oldest 100-mile trail race, which is notoriously tough to get into. You have to qualify and then enter the lottery, or you have to be a top finisher at one of what are called golden ticket races, where then you're granted an automatic entry. And Lauren did that last year, when she placed third at the Black Canyon 100K, which she describes as a breakthrough moment that led her to that Western States endurance run. And she came in 13th despite having a whole lot of life stress on her plate. And she's since been dealing with some injuries, which I'm sure many runners can relate to. So we just dig into all of it. We talk about her story and the common gynecological issues that she helps peri and menopausal women navigate. And of course, what makes a good pair of performance underwear. It's just a really fun, informative conversation, and I hope you enjoy it as much as I did. All right, before we get to it, give us a follow at Feisty Menopause on Instagram and Facebook. Come on in and join our private Hit Play Not Pause Facebook group where we have about 35,000 women sharing stories and helping each other out. And tap the link in the show notes to sign up for my free weekly Feisty 40 Plus newsletter with all the training and health news you can use. Thank you, as always, for the great ratings and kind reviews that keep coming in. It is always really exciting to see new reviews on Apple going on 5 years into this show, and it really does help continue to grow this podcast. And also, if you like the show, please share it with a friend. That's really the best way to keep expanding our universe here. Finally, before we get to it, very quick thanks to MIDI for their continued support. I know so many of you who are loving their easy-to-use hormone therapy services, so thanks a ton, MIDI, for your support. All right, enough of me. Let's have a few words about our awesome sponsors and get on with the show. All right, Lauren, welcome to the show. I'm psyched for this conversation.
Yeah, thanks for having me.
So we met through our new sponsor, Paradis Sport Underwear. And though this is not an infomercial by any stretch, I am curious how you got involved with an underwear company.
Yeah, so actually through like most things, I suppose these days, social media, they must have seen any one of my posts or whatnot about being a gynecologist and being an ultra runner. And they were like, this is like the perfect union of what we're looking for, somebody who knows more than just practical kind of I'm a runner or I'm active, what I use underwear, what am I looking for, but also knows kind of more, the medical side behind underwear and vulvovaginal health. So it's kind of this perfect marriage of experience in being active and experience in the female health world.
So maybe a personal question, but do you wear underwear when you run?
Sometimes yes, sometimes no.
Okay.
It depends. When I wear like shorts,
Yeah,
I don't, but when I wear long tights, I do.
that makes sense.
I don't know why, but I feel like that's kind of, ultimately it's like a personal choice. Commando, thong, brief, whatever you prefer, right, is a personal choice. But if you're going to wear something, right, what should you be looking for? Kind of a,
Well, why don't you tell us that actually? Like, what should you? Because during this time of life, I mean, we do hear that UTIs become more of a thing. And we know that like the tissues change and we talk a lot
yep,
about vaginal estrogen on the show and we can
yeah,
bring it up again here, but like what should people be looking for? Because we do have quite a bit of ultra riders, people who do 100
yeah.
milers, people who run distances. What should you be looking for?
Yeah. So, I mean, first and foremost, it's very different what you're looking for your everyday life versus when you're being active,
Okay.
right? Like, and that's probably what people are really confused. They're like, I don't know, my gynecologist told me only cotton underwear. Please don't wear cotton underwear. We're exercising, right?
Why did they say
Sure.
that?
Because it's breathable, right?
Okay.
And so underwear or natural cotton underwear at night or commando at night to let everything kind of air out, if you will, fabulous. But when you're exercising, you don't want cotton, which retains moisture and keeps it wet, doesn't dry very fast. You don't want that up in there, can only cause more damage. So that's like the big difference and why I think it's confusing because everybody's like, they say cotton, but not while exercising. Want a total different thing while exercising because of that moisture that you want to be quick drying. And
Gotcha. That makes sense.
yeah, and not so worried about breathable because shy of like, an ultra run, I suppose you're not in it for hours on end, right? When you're normal everyday training or normal everyday use. Yeah, but
Yeah, yeah, yeah. So the cotton is fine, is what you're saying for most everyday
yeah,
use. But
for day
yeah,
to day
yeah.
use. Yeah. And then, like, once every once in a while, if you're doing a longer ride, sure, it'd be better to be in that. But once in a while is not going to change vulvar health as far as, for that occasional long distance or long ride or long run. So for the everyday training, you want something that's quick drying, even if it traps more kind of, if you will, moisture, it's not going to be on your skin for long. So that's okay.
I'm gonna cut this because I'm a little confused.
Okay.
So the let me level set here. So the parody underwear is wicking, right?
Yes.
And quick drying.
Yes.
Yes.
So think of it like a t-shirt. Like you go out for a run or a ride in a cotton t-shirt and you're
Right.
going to be like a sweaty
Oh,
mess.
100%. Like
Yeah.
I'm following you. I think I just there's something conflated at the end there
Yeah.
where you were
So
saying it doesn't matter, but maybe you were talking about cotton if it was short.
yeah, I'm talking like, well, I do, a 18-hour race. Who cares if it's a race? I'm talking every day. Like, yeah, you're gonna have the one-off long time you're wearing because you don't want to be in something that doesn't breathe very well but wicks away moisture. You don't want to be in that for a long time. It's fine if you're in it for a race at once every couple of months. Don't panic. On the day-to-day basis is where you're talking about it when it's a shorter time for a ride um or a run. Does that kind of make more sense?
Why am I so confused? Um,
Yeah,
cotton
yeah,
underwear to my understanding does not dry well, right? It's not very
exactly,
wicking either, right?
exactly.
But
Yeah.
the parody underwear, are you saying it almost sounds like you're saying it traps moisture, but it doesn't, right?
I mean, if you wore it for like all day, then it would in theory, right? Because it's just not as breathable, right?
Oh, okay. This is what I'm
Yeah.
trying to understand.
Yeah. So it's
Okay,
not as
okay.
breathable. So in theory, if you wore it for a really long time,
Mm-hmm.
you wouldn't want that. But when you're for a short time exercising, going to be sweating a lot, you want something that's going to quick dry and kind of get that moisture away. Over the long term, it's not going to be as breathable, right? But like every day you're working, you're not like sweating buckets every day all the time. I mean,
Right.
hot flashes aside, right? So you want something that's breathable, it's okay. But if you're gonna be sweating, so moisture is gonna be in there, that is when you want something synthetic fabric that will be more that active time frame, getting the moisture away from the body. Make sense? Like
It does. It does.
it's so
Is
that
it
the
if
fabric
somebody's
is
out there all day, like I just
yeah,
want to make sure that we're communicating clearly
yeah, yeah,
because I mean there are people who are going to be out there like for a long time,
yeah, yeah.
in hiking, whether it is, in these underwear. So I want to make sure that we're just communicating.
Yeah. So let me see how I can explain this. So the underwear itself retains the moisture. So it's not
Yes.
on your skin, right?
Yes, yes.
Underwear
Okay.
itself is keeping in there. So if you sit in there it all day, kind of like sitting in a bathing suit, the moisture is going to stay, right? It's going to like kind of trap in there. So for when you know you're gonna be super active and super sweaty, great. Have the sweat stay in the underwear. But then when you're done exercise, you want to get out of that and
Yep.
into either nothing or cotton.
Okay.
That
How
makes
can we
sense.
say that? Yeah, like
Yeah.
let's
Yeah. Okay.
make this a little clear, like,
Yeah.
starting
Yeah.
over to make that clear because it wasn't
Yeah. Yeah.
tracking well in my head. I was like, I don't understand what's
Yeah. Yeah.
happening.
Yeah. Maybe it's more of that the moisture or the your sweat stays in the underwear and
Yep.
not on the skin. And so that's okay for while you're exercising. But when you're done, yeah, I'll say it that way.
All right, let's do that. Okay.
Okay, that was good.
That makes more sense. Okay, take two. So we understand that like our gynecologists usually tell us like cotton underwear because it's breathable and all of that. But what happens when we exercise and why are we thinking about underwear differently when we're exercising?
Yeah. So when you're exercising and you know you're going to be sweaty, you want underwear that will get the sweat away from your body, kind of traps it into the fabric, and will quick dry. Right. So for that, we know we're going to be sweaty and we don't want it against our skin the whole time. You want a fabric that's will absorb it and not keep the moisture against the skin. But
Right.
then when you stop exercising, so you're not going to be as sweaty as before, that's when you can have underwear that is more breathable
Yep.
and will kind of let your other parts dry on their own.
That makes sense. That makes sense. And what is it? Is it just because the body temperature with the moisture is a breeding ground? Is that
You
why
got
we're
it.
concerned about that? Yeah.
Yeah. I mean, you at like, where does yeast grow? Dark, moist. Uh, and that is exactly what the vulva and vagina are. And so you want to keep it not like that as much as you can.
Yeah. No, that makes a lot of sense.
Then you add in there, the changes that happen after menopause, right? The vaginal tissue is not as strong, not as resistant. The natural lubrication can change the pH. So now you're even more prone to infections, and that can make it even worse during the perimenopausal postmenopausal time frame with the vulva, the vagina, the
Yeah.
whole genital urinary syndrome of menopause changes can exacerbate all of that.
We're a huge proponent of vaginal estrogen here for those
Oh,
reasons.
yeah, I think I prescribe it. I mean, it has minimal risks, a ton of benefits. I
Yeah.
feel like I am like a vaginal estrogen pusher sometimes.
Me too. I do think
Yeah,
everybody like
yeah,
it should be over the counter, honestly.
yeah, right?
Do you think that there's merits to the chamois cream that is made for women for the pH balance? Are you familiar with those products?
Not chamois cream. There's another one, is it Femdophilus? And there's another one out there. Um, and the problem is double-blind placebo-controlled trial. Will they help everybody?
Hmm.
Probably not. Do they help you? Maybe. Is there a ton of harm to it? Probably not, uh, except for cost, right? So that's the big question is it worth the cost of it?
Yeah,
But
in this
not
case,
seeing
it would
harm.
just be a cost neutral, I believe. Like, I don't believe that the women's specific chamois cream for cyclists that is advertised as being healthy for your pH balance
Yeah, yeah.
costs more. Yeah.
It doesn't, yeah, or it doesn't cost a lot in general.
Yeah.
Like, yeah. So yeah. So probably, I mean, is it if it helps you, great. It's probably not doing any harm that we can see. So if it works for you, there's no sense in stopping it.
Yeah, for sure. So let's talk a bit about your own background.
Yeah.
because you're an OB-GYN as mentioned. And when did that become your calling? And my understanding is now you sort of took the OB out of the OB-GYN and you're mostly a gynecologist, correct?
I did. Yeah, yeah. So actually not until medical school. So medical school, the first 2 years is just book work. And then in your third and fourth years, when you start to go around and do you have to do like a month rotation in a lot of all the different areas. I thought I wanted to be a pediatrician because my mom was a NICU nurse. And so I thought I
Oh.
wanted to go to pediatrics. My first day in pediatrics, I was like, get me out of here. I do not love this area. Now I don't love kids, but I don't love this area of medicine. So from there, I really found myself gravitating towards surgery, and I liked the surgical aspect of medicine. And then from there, we're trying to figure out what area of surgery. I didn't like general surgery, like the length of the surgeries and just the kind of lifestyle, which is funny because I went to OBGYN, but just the kind of the pace of life. And then I really, really liked urology, but couldn't deal with kind of the old boys club of that. It was very
Mm.
not fun. And then I kind of found OBGYN, where I felt like it was this perfect marriage of a little bit of primary care. So you kind of know your patients, you have long term relationships. That is really rewarding. But also, if you have a problem, I'm the surgeon who can fix it. And so I really liked that. And the surgeries aren't like silly long, like, it's like 2 hours. And it wasn't like I was doing these like 18-hour cases that were not my cup of tea. So I loved that kind of marriage of them. I think the reason why I really liked urology is because it went more into prolapse and incontinence, and I liked that aspect of it, which obstetrics or gynecology I get to do as well. I mean, I loved pregnancy and I loved my pregnant patients, but it was never what made me fall in love with the specialty. I think it was that kind of long-term care combined with being the one who does the surgery, not just having to like refer you to somebody else that I really
And
gravitated towards.
and babies can take a long time coming and are very
Yeah.
unpredictable.
Yeah,
Like,
exactly, exactly. The nights, weekends, and holidays was not conducive to training or any semblance of a family life. So that's once I had the opportunity to drop that, I jumped all over it.
yeah, I mean, a lot of people in this audience can relate to that because we do have a lot of women who are in their 40s and perimenopause. They have
Hmm.
kids, they're trying to balance this job, they're
Yeah.
doing all the things. And I heard you talking on, I think it was the Moms of Medicine podcast,
Yeah.
all about that. Um, how you have two kids, you have your own practice. How do you fit in training for ultras? You do like
Yeah.
100K, 100-mile runs.
Right, right. Yeah. So, I mean, a lot of it's early morning, right? Like it's up at 5 a.m. So that way I can get to the trail, get to the wherever I'm doing that day. And then try to go straight to the office so that way I can do, and I have like a little like weights in here and a yoga mat so I can do all the other kind of stuffs I need to do, which means I had to work with my husband, my partner, to be like, you get mornings, right? And then I'll do the after school stuff. And so that's kind of how we divide it so it would work. Sometimes it's more difficult as far as like kids' activities and, weekend sports and all that kind of stuff, which is not as much as when they're babies, but now as they're getting older, it's like, oh, we've got a gymnastics meet up in, Loveland, and oh, another soccer game down in Puebla. And it's just like, that makes it a little bit more difficult. And you kind of have to decide if you're going to miss it or if you're going to come late and how to kind of work that. But that tends to be the harder part, at least during the work week. I've kind of got that chiseled out time. That's my time, that I get to do my bigger run. And
Yeah.
then, the second run of the day or whatnot, then I can usually do while I'm, after I drop a kid off at this sport and then do a little run and then, go pick up another one from that one. So that's, having a partner that partners with you is key.
Yeah.
Yeah.
Yeah. Does he run or
He
do any
does
of that?
not. No,
Okay.
not even a
Okay.
little bit. Actually, he's a rock climber. That's what his like love is. And he is getting into mountain biking, which has been awesome because now he can bike alongside me when I run, which has been really fun. And kind of a new
Yeah.
aspect. Yeah, now that he's a little more confident. I think he's been doing it for about a year and a half now. He's getting more confident and he'll come along with me. And I really enjoy that. So I'm glad he's
Yeah,
getting
that's
into mountain
cool.
biking. Yeah.
Yeah, that's cool. So you had a like a really great run in 2024, right? And that was
Yeah.
quite the year. Talk a bit about qualifying for Western States and your Black Canyon 100K.
Yeah. So I definitely went into, well, I've done several like golden ticket races trying to get into Western States. I think as I got more and more into ultras, that became like a bigger and bigger goal of mine, just because of kind of the uniqueness of the event. So I'd done several golden ticket races and kind of always seemed to do okay, but never get a golden ticket. So I just kind of went into that race, especially because it's so competitive with the same kind of like, all right, here's another race. We'll try again, but low expectations. I think it was like the perfect combination of I just dropped obstetrics. So I was like getting regular sleep. Job was pretty stable at the time. And like all the things kind of worked out. Training was going well. And then the race, I just kind of not gave up on the golden ticket, but was just kind of like, well, I'm going to run my race. This is my goal time, and I'm just going to keep going. Even if, I don't think I'm going to get it. It's not the ultimate goal. It's still to do better than I did before. And just kind of had that mindset of like, you're hitting your times, you're doing great. Don't even think about anybody else. You're competing against yourself at this point. And then I was also, my crew didn't tell me, I was listening to an audiobook. I think it was Fourth Wing, if I remember correctly, like just in La La Land, listening to this, spicy book. And so I crossed the finish line and didn't even know that I had gotten a golden ticket, which was really cool to kind of be surprised by that. And then it was kind of a, huge excitement, right? Like, I can't wait to do this race. This is so exciting. Like, I thought I was going to be 72 by the time I got, into the lottery, like couldn't believe it. So was super excited. That came down, crashed pretty quickly because it was within 2 or 3 weeks that is when my job that I had decided to get rid of all their specialties. They were just going to focus on primary care and pediatrics. And so that's when I found out I was no longer going to have a job. And what was I going to do with, my life, right?
Wow.
Do I get another job with a general practice, but then they're going to make me go back to obstetrics. And I did not want to add that back into my life. Was I going to retire? Like, I wasn't done with my career, my profession. Could do that, or do I, at least if I still have contacts with my patients I've had since I started here in 2013, and try to open up a private practice, kind of being able to communicate with them for the next several months. And so that's the route we went. So training was difficult because I was trying to start a private practice, trying to
Oof.
still do my job because I was still there. They gave us like a really long time. They told us in April, and we weren't done until August. So that way we had enough time to like tell patients and obstetric patients, etc. So still doing that job and trying to like train for like the biggest race I've ever done. So that was a really difficult, stressful, not so fun time. So I'd kind of just like, I'm just going to go to Western States and just have fun. I say that, but I'm super competitive. So I knew I was going to put a lot of pressure on myself, even though, but try to at least like enjoy it, because what I always say, it's better than going to work, right? I get to do this. And so try to still enjoy the process, even though it was stressful and kind of not the most amazing route to or for training for Western States, which was, it was an experience, and I'm super glad I went and I finished. So that was exciting. Not my best race, but I didn't think I expected that much with all that was going on.
And for those who don't know, can you explain, is getting that golden ticket a time like Boston or a placement like a podium?
It's a placement like a podium. Yeah.
All
So
right.
there's, I want to say maybe 9 or 10 races across across the world. Some of them are internationals. A lot of them are in the US, and each one gives out 2 or 3 tickets. So I think there's 11 golden tickets total,
Yeah.
mostly 2 tickets per race.
And are
So
we going to try again?
yeah. So because I'm not happy with my time at Western States. I have this, and this is my competitiveness. Like I got to go back and I got to put in a race I'm proud of. And so now I'm on the quest to go back again, which is where Javelina came in. That's what was in October. And I
Mm,
missed the golden ticket by one place, which was a big bummer.
that is
Yeah,
a big bummer.
I know. I know.
And it looks like you're dealing with some injury from your
Yeah.
Instagram. What is
Yeah.
happening there?
Yeah, so I started kind of right around after Javelina, something with my hip. I'm not sure if it's like hip flexor or what's going on, but it was kind of like getting better and then worse and better and worse as I was trying to train for Black Canyons, and thought maybe it would kind of hold on, but it was pretty painful all during Black Canyon race. Unfortunately, got a MRI just to make sure it like wasn't a stress fracture. I wasn't going to do any harm by racing, and there was, I guess, potential bursitis and a torn labrum. But from what I understand, like 80% of runners have a torn labrum. So it could just be an incidental finding. So I don't know if that's actually what's causing the issue or if it's more of kind of muscular. So I'm still working with PT. I was on the bike for a while, and now I'm back to more running and doing okay. We're slowly getting there. Now it's a lot more of just getting back into shape and getting the strength back.
Yeah. What's next on the calendar?
So I was gonna do Gorge because that 100K is the qualifier to get into the U.S. Trail running team to compete in France or Spain, technically on the border of France and Spain. I'm not sure it's such a good idea since I am not at my best right now. I'm
Yeah.
still coming back. So it seems like a pretty silly idea to try to do a competitive race again and not be 100% trained. So I probably won't do it, but that's what's next on the calendar in
So
theory.
you so you are 40 yourself, is that correct?
I will be 41 or 42 in a couple weeks. I'm 41 right
Oh,
now.
somehow I missed a couple years.
Yeah.
Okay. Um, no signs of perimenopause at this time?
Not yet. I got my trusty Marina, so I don't have periods. But not yet that I can tell.
I imagine you must work, especially where you are, and train with women who are in this phase of life. I mean, there are quite a
Mhm.
few women in their 40s running and
Yeah.
50s and beyond running these long races. Can you talk a bit about like some of the common things that you see at this time of life in your practice?
Yeah, so a big one I see, especially with my cyclists, is kind of what we talked about before, is there either sometimes even urgency or even inability to pee after long rides. And so that is in there, like I said, incontinence or urgency, or just the genital urinary changes of menopause and how that impacts all the above, even just labial issues with long rides specifically. So I see a pretty good amount of that. Prolapse, I do a lot of prolapse stuffs. So whether it's surgery or pessaries or just getting them to physical therapy. So that way that can be less of a problem while they're active. And then due to a lot of menopausal kind of hormone therapy, I usually see that when they come in with more of the joint pain than anything else. Yeah, they're not sleeping well. Yeah, that, but usually it's the joint pain that's kind of more bothersome for them, especially staying active in that regard. So
Do
those
you
are
find that the hormone therapy helps resolve that?
for joint pain. Yeah. Uh-huh.
Yeah.
Hormone therapy helps with a lot of things, doesn't directly help a lot of things, but joint pain is one of the ones that tends to improve with therapy.
And what about the urinary urgency and those issues that you're saying?
So some of it, yes, especially with the vaginal estrogen, but systemic hormone therapy uh, doesn't. About 50% of women get improvements vaginally. So it's not, that one is kind of a hit or miss depending on the person. But then the question is, do we need specific vaginal help, or is this a combination of systemic symptoms and vaginal? And then are they going to be part of that group? Okay, it's kind of one thing hits both, or do they need both systemic hormone therapy and vaginal estrogen as well? So yeah, it depends on exactly what their problem is and how they respond.
And with the prolapses, I know we have women who are experiencing that and
Mhm.
struggle with like lifting and running and
Yeah.
all of the things. What is your first tool in the toolbox when you encounter that?
Yeah, I physical therapy, going to a pelvic floor physical therapist is so helpful. Even if it's not 100% you're better and we end up needing to do surgery or needing to do pessary, it's only going to get worse with time. And so if we do nothing or we do surgery, we've just and we're going to go back down to where we were before. So getting them in at some point, I feel like sometimes I have to convince people that no, it really, really is helpful and can make, yeah, it's not going to reverse your prolapse, but can it make it a lot less symptomatic? Absolutely. Can it help it from being worse later on? Absolutely. And then we can avoid surgery altogether. So that's my first. Sometimes it's difficult to get people in, whether it's because insurance doesn't cover it or just they're uncomfortable with the concept of going to somebody who might do some internal work. But yeah, that's definitely my first and foremost is trying to convince them to do that, depending on the prolapse and kind of where they are. Sometimes it's doing a pessary because they're like, only when I'm active, only am I out hiking that I have a problem. Pessary's super not fun to deal with all the time, but if you're just using it for when you're active, it's kind of like putting on a knee brace. It's kind of like putting on sunglasses. It can be just for that activity and you don't need it all the time. And I think it's great to avoid surgery if you can, especially if it's just episodic. So that is another one that, I think people, I think with the introduction of menstrual cups being more common, that people are a little bit more comfortable with the concept of a pessary. So that's been good as well. But that's definitely one that people don't realize or don't kind of think about before we discuss it.
Now, a pessary, I have never used one myself, but
Mhm.
is it like a disc? Is it like a
They
slightly
can.
like okay.
Yeah, they come in lots and lots of different sizes and shapes that are for different degrees or different types of prolapse, whether it's the bladder or it's the rectum, whether they have incontinence or not. I suppose the uterus too, whether they have incontinence or not. There's so many different sizes and shapes. Some are really hard to get out, which are great for really severe prolapse, but not so great if you want it just episodically or still sexually active. And then some are much easier to get in and out. So those are the ones that we'd aim for specific activity. Or, like I said, if you're still sexually active and want to be able to take that out for when you're intimate. Mm-hmm.
Is this something that you are fitted for, or
Yeah.
you just get okay? All right.
Yeah. I'm pretty sure I had a patient, I feel like she said she ordered one online. So you can order them online. The question is, will that size and shape fit? And will it fix the problem without causing any? I would say it's like Goldilocks, right? One that's not so big that it's painful, not so small that it falls out, just right. You should barely feel it or know it's there, and it should do what it's supposed to do, fix the problem at hand. So, you run the risk of not getting one. But a dish pessary is pretty common and pretty universally tolerated. As long as you don't have really severe prolapse, right? Then usually that. So, if you order that online and you go for it, because, copays and whatnot are expensive, then you probably would do okay. But if it doesn't work or you're a little more complicated, then may need to get fitted for one.
Yeah, we hear women who have issues with because their tissues are changing and they have some atrophy going on, that long runs are becoming far less comfortable because they feel like the inside is rubbing on the outside, for lack of a
Yeah.
better way to put it.
Yeah.
Yeah. How do you help with that situation?
Yeah. So, I mean, a lot of it's because A, prolapse might be involved, or B, just even the vulva changes, right? It loses a lot of I suppose the plumpness, if you will, of
Hmm.
it, right? So, some of that changes. So, sizing of things changes and you don't even realize that, right? So, size and shape of clothes can be part of it. As far as, vaginal estrogen, vaginal estrogen, like I'm a pusher of it too, right? That can help significantly, even if you don't have all the other things, pain with intercourse, incontinence, but just have that dry feeling. And then I'm a huge fan of zinc oxide barrier cream because it lasts a long time. Like annoyingly, it doesn't come off, but it's bet your chafing creams are fine and dandy, but I feel like you have to reapply them so often, and reapplying to the lady bits is not usually the most fun to do while you're moving. And so putting zinc oxide down there,
Like a
it's
Desitin?
like a Desitin, like a, was it Boudreaux's butt paste? Yeah, those are gonna, and they are just gonna keep. So it's a little bit of the moisturizing. They usually come with like vitamin E in them as well, which can be totally moisturizing. Coconut oil can also do that, but then you kind of smell like the tropics. So but that's, I mean, that's good for you. But anyways, putting that cream, on top of it just to keep either kind of the estrogen sealed in if you do it after that, or just keep that kind of scratchy sensation, if you will. Yeah, that
Yeah.
rubbing sensation. It really, really helps. It's
And
messy.
what about the crime scene bleeding that some women
Yeah.
get during
Oh gosh.
perimenopause?
Right. The surprise too. It's like that's the worst of it. It's like if you at least you knew it was coming, let alone like when is it going to happen, and if it happens, how long is it going to be, and heavy, not heavy. I personally and professionally, the Marina IUD, I think, is the best thing since sliced bread. If you can tolerate it, insertion, which is usually not so fun, but not too bad, is going to be the best. It's like set it and forget it. You don't have to think about it. It also makes going on systemic hormone therapy a lot safer. And so it's kind of all encompassing. You don't have the long recovery of a surgery. Or the cost of a surgery. Endometrial ablations are great for kind of that perimenopausal time frame. Too early and they're not so great, but there's cost to that. So, right now at least they're covered by 100% by insurance as preventative. And so I said, if it's something that you can tolerate inserting, or like the idea of it, I think that sometimes bothers people, that the levonorgestrel IUD is best thing out there.
Yeah.
Yeah.
And I mean, like you said though, sometimes you just don't know if it's coming. I mean, I started using the menstrual cup
Yeah.
uh towards the end, and I thought it was just like honestly the best thing because
Yeah.
it didn't leak. It was very
Yeah.
easy to just keep it there and do a 100-mile ride and not worry about it.
Yeah, yeah. I say I use menstrual cups too, and I love them. I tried the dish recently and not a huge fan, but I
Me
know
neither.
some, okay, I didn't know if it was just me. And I was like, I feel like when I'm out and I'm doing the nature potty, and I was like, this thing's gonna come out. And I not a fan. I thought maybe it was just my anatomy. I don't know, but my menstrual cups, shy of my dog, somehow always finding them and eating them. So it's been a problem. I was not a fan of the dish, and I really miss so now I have to order a new menstrual cup because they said my dog ate my last
I
one.
just never I had no success with the dish either. Like
Yeah.
it didn't work. I didn't know if it was user error,
Yeah,
but
yeah. I was like, I feel like I used the menstrual cup and I got that down. I feel like I should be able to figure this out. I kind of know my anatomy pretty well. Like, why can I not figure this out? And I'm glad I'm not the only one. I thought maybe I was a variant or something, but nope, not a fan.
are there any other gynecological, vulvovaginal, any of the things that you encounter that you think women should know about in this audience?
Yeah, let's see. Trying to think of all like the uh big, yeah, I'm trying to think of, so in, urinary incontinence, prolapse, just in general. I mean, not specific, but just all the benefits of, hormone therapy as far as on your body and muscle mass retention, as far as keeping you um, active and not prone to falls or that kind of stuff. But I'm trying to think of other big stuff. Hysterectomies are great, but it's going to keep you out of out of training for a while.
Hmm.
So that's, they're great. They don't, they're pretty minimally invasive these days, but still a pretty long recovery. So that kind of keeps you out more. I think
And
anything that
just a
makes
partial hysterectomy. Are you talking about as not as
yeah,
opposed to
yes.
an
Yeah,
oophorectomy?
yeah. Yeah. So oophorectomy, I would not recommend unless you have such great reason for one, i.e., you're a BRCA carrier and your risk of ovarian or breast cancer are so high that keeping your ovaries at all cost is the goal. But the uterus, if you're not planning on growing a small human, there's really no there's no purpose to it anymore. So yeah, you can get rid of that. Does it increase your risk of prolapse? Maybe slightly, but the number of people who have uteruses and have prolapse that I see, I don't know if it really does, because I see them both equally. Um,
What about fibroids? I have a couple friends in the
eh,
community dealing with those right now, and they seem really problematic.
yeah. Fibroids are definitely going to make any of that bleeding problems that you may have so much worse. The problem is when they get really big, to the point where you feel like you have a baby in your pelvis, and that there's good. We can do some procedures like uterine artery embolization, but usually that leads to more pain. These are more minimally invasive stuff, so you're not keeping recovering from surgery for a long time. You can do some medications which can help, but a lot of them are going to be anti-estrogens, which is going to make all of your super fun menopausal symptoms even worse. You can do a little bit of add back therapy to try to help, but that's usually the biggest complication with that, and they're expensive medications. And then you're talking about surgical, which like laparoscopic myomectomies are usually not too bad. They're can be complicated and make like a hysterectomy later in life more complicated. But there's a new procedure where you almost ablate the fibroid itself. So it's done laparoscopically, but you just kind of ablate the fibroid, cut off blood supply to it. So it's going to make it from a softball, if you will, to a marshmallow. So it's not as bulky. So it helps with some bulk symptoms. And then if the fibroid's not there functionally, you get better improvement in bleeding as well. So that can be helpful. It is surgery, so it does have a week or two of recovery, just where your abdominal muscles are pretty sore. But if you've tried all the medical stuff, right, you've done your pill patch ring, you've done your anti-estrogens, you've done your IUD, and nothing's working, because anemia, feeling like you have a bowling ball in your pelvis, none of those are going to help with your performance. So fixing those is going to be key. So sometimes it does take a couple down weeks to kind of get that. So I'm doing more of those procedures just to avoid the hysterectomy
Hmm.
with recovery. I have a more track and field athlete who's got pretty big fibroids, and we're trying to figure out with her schedule kind of if we're going to do something or not, right? Because she's like, compete here, and how do we time this to help from there? Yeah.
Are some women just more prone to them?
So, I mean, yes, some women, Black women tend to have more commonly, but somewhat upwards of like 80% of women by their time they're 60 have fibroids. So they're also just super common. It's hard to know if it's genetic or not genetic.
And they
Pregnancy,
might not be symptomatic
yeah, a
then.
ton of
Yeah.
people have them and don't know. And some people have like one tiny one and they have awful periods. So it's, they're a known risk factor to make your periods heavier, more painful. But they're not always symptomatic. But when they do, or they're just super big, that's when they tend to be more of an issue.
And then I guess the final question I would have is like, when do you decide, when I sit in meetings and we talk about the different hormone therapy
Mm-hmm.
uh, options for women who are in the perimenopausal period specifically, some doctors are just like, I like to just take the ovaries offline with a contraceptive pill and then just put some hormones in so we're not layering hormones on top of hormones. Other people are
Mm-hmm.
like, well, I'd prefer to like work the menopausal hormone route. Do you have thoughts on that? For
Yeah. So,
perimenopausal women specifically. Yeah.
yeah. So I think it depends on a couple of things. What is your form of contraception, right? Because we don't, not that it's high chance you're going to get pregnant, but definitely don't want that to happen if you don't want that to happen. So like a woman with a vasectomy as her contraception, she doesn't have super like heavy periods in general. I'm going to go straight to hormone therapy just because side effects and risks are dose dependent, right? So the lowest effective dose we can do. So if we don't need it to potentially prevent ovulation and pregnancy, and if their periods in general aren't a problem, we might be able to get away with hormone therapy doses. But if they don't have any other form of contraception, or their periods tend to be very heavy, very long, we're probably gonna have to go the contraception route and then, add on from there if we need. So that's usually is kind of, what are your periods like generally? Is it a problem or not too big of a problem? Do you have, fear of pregnancy or not? And then from those two factors can figure out what would best work in there. But usually I try if I can to get them on the hormone therapy dose just because it's safer in general. If we're comparing head to head.
Right.
Yeah.
Right. And like you were saying before, if someone has an IUD, then at some point, are you just adding estrogen to this equation?
Yeah. Yeah. Yeah.
Okay.
So, the biggest reason we add progesterone is just to protect the uterus from getting cancer from the estrogen alone.
Yeah.
But we add estrogen and progesterone together, and that's where we start to see the increased risk of breast cancer. Whereas if we do estrogen alone, we're not seeing that increased
Right.
risk. So if we can get away with estrogen alone, especially transdermal, the safest kind of the combination by doing an IUD, or if you've already had hysterectomy, that would definitely be the kind of all we need to add. Does progesterone have some effects? Sure. But if we can avoid it, like I said, for safety reasons, then we can, then we should. Yeah.
Yeah. So the progesterone in the IUD is local.
Right. Right. Doesn't go
Yep.
systemic. Yep.
Yep.
Exactly.
Yep.
Exactly. So that's how we get to avoid the
Yeah.
estrogen plus progesterone risks.
Yep.
Yeah.
Excellent. Is there anything that we haven't talked about that you think the audience should know about any of these things?
Yeah, I think one of the biggest things, because it makes me really sad when I hear that women, their symptoms are either dismissed or not talked about, or that's just part of life. I always hate that. And the times that I find myself doing that is when women are trying to throw in, like they're there for their annual and they're trying to throw in, oh, by the way, which is a huge conversation to talk about hormone therapy in general, this menopausal transition in general. And so my biggest advice is make a separate appointment to talk about it. Don't try to jam it into your well woman because there's not enough time, which means you're going to feel like you're dismissed. And it's not because it may be because that particular doctor doesn't want to talk about it. Fine. But that is probably factoring in. And so if you want your symptoms addressed, that is the best way to do it. And if they don't want to address it or if they dismiss you, find somebody new.
Yeah.
Right. Not every, just like I'm not the OBGYN who loved pregnancy and like lives for that. Not every OBGYN maybe um, loves hormone therapy or the menopause part of it. I do, but so it might just be that you need to find somebody who either likes it, feels comfortable with it, but definitely has time for it. So I'd say that's probably one of the biggest things. I feel like I'm always telling friends, like, I know, copays suck. I get it. Insurance sucks, but that's the best way to get it addressed so you don't feel dismissed or find a new doctor.
No,
Yeah.
but that's a really good point, and I actually haven't considered that. And it is, and I hear doctors talk about that doorknob moment, like when they're
Mhm.
walking out the door and like, is there anything else? And someone's like, yeah, I've got all these menopause symptoms, and you're just
Yeah.
like,
Like
uh,
that's a
like,
solid 15-20 minute conversation, right? And you're like, oh, and I'm already running behind, and the next person's gonna be mad, and I don't want to not talk about it, but
yeah,
right. And so it stinks. It stinks on our end. I don't like doing that. I understand why they wanna while they're there. But it definitely
yeah.
just complicates it and throws off your day. Yeah. And I'd say
No, that's good advice. Make a
yeah.
unique appointment to talk about it.
Yep, yep. And I said the last thing would be just to I don't know how to say this nicely, demand better knowledge, education, research. Don't tolerate low standards of women deserve better. We deserve good studies to have the best outcomes. And I understand world of kind of bioidenticals came from, and that it came from a world of women being ignored. But we deserve better than that. And so be careful of what you're getting and where you're getting it from. And sometimes it's marketing. So just, look into it a little bit more and be a little
Well,
bit more.
this
Yeah.
that's a whole other.
Yeah.
I actually, Lauren, really kind of wish that the mainstream medical societies would just adopt bioidentical themselves because it's so confusing. Because estradiol
Yeah.
is bioidentical, like we're
Yeah.
using micronized progesterone is,
Right. Yeah.
so it doesn't have to be this special compounded thing,
Right.
to be a
Yeah.
bioidentical hormone. And women are still so confused about that.
Yeah. And I think that it's confusing. I mean, I remember being confused until I really sat down, and it's like, it's, it's, I mean, if you want biologically what's identical to what your body makes, well, that's estradiol. I mean, it's still synthesized in the lab, right? So it's not, right? Uh, so I guess, but synthesized in a lab doesn't mean it's not good. Natural doesn't mean it's good. It also doesn't take into effect the safety. Like people are like, well, I'm going to go on bioidentical because I have family history of breast cancer, so I don't want to do that risk. I'm like, oh no, 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 no. There's the same hormone. And so
It's
they
the same
think
hormone.
it's safe, right? And so they think it's safe. And I think that's so dangerous that this marketing ploy, for lack of better term, is making women think that they're safe when they're taking on the same risks, and they should know that. And then they can I mean, if they're given information, we're smart enough to figure it out. Give them the information. You can decide what's best for you. But we don't need to lie about it. We don't need to do a great marketing ploy to make you think. And then all of a sudden you have no idea what your risk factors are, and you don't know what you're looking for if there's any complications. Yeah, micronized progesterone is biologically right. But that being said, your progestins, you're not, but there's a lot of benefits to them too. They sometimes have less side effects. Sometimes they'll help better with bleeding profiles, right, than your oral micronized progesterone. So sometimes, we can live better by chemistry. Just because it's natural doesn't mean it's better. And sometimes the
Yeah.
not biologically identical has a ton of great things that you may want because it works better for you in your conglomerate of symptoms and side effects. So yeah, I think it's sad that we're being lied to, right? And manipulated when we shouldn't be. It should be straightforward. But capitalism is capitalism. So I get it and you ignore women and their symptoms for long enough, right? And we're gonna figure out a way to treat that or do something about it. And unfortunately, that kind of has made for not so great outcomes. But yeah, so like I said, that's the only other thing is talk to somebody who likes perimenopause, who likes menopause, who likes hormone therapy, who's not afraid of it, and is willing to give you all your options so you can make the best decision for yourself.
I think that's a great place to wrap it up.
Yeah.
Thanks for being here.
Uh-huh.
Well, that's our show. Come on back next week when I sit down with Marissa Axel of AXN Fitness and Coaching, who helps midlife athletes like us become badass cyclists by showing them how to become stronger, ride further, and reclaim their mojo, all while training less. So come on back for that one. And until then, as always, stay feisty. You've been listening to Hit Play, Not Pause, a feisty menopause podcast for active, performance-minded women. I'm your host, Celine Yeager. The show is edited and produced by the strong, talented, and amazing women at Live Feisty Media. Follow us on social media at Feisty Menopause, and please help us spread the word. Screenshot and share this episode on your social media channels with the tag @FeistyMenopause. Share the show with your friends, and please subscribe, like, review, and rate this show wherever you get your podcasts. Word of mouth and good reviews make it easier for other listeners to find. Thanks for listening, and as always, stay feisty.